We are the Group 8 named Gascon, Acosta, Nakita, Domingo, de la Peña, Claveria, and our topic is about malaria. For the definition, I'm Nakita Zairami. Malaria is rampant in rural areas, and malaria is caused by an infected female Anopheles mosquito. Parasites can be transferred to human bodies through bites. It can be avoided and it can be treated as well. Human malaria is caused by 5 parasite species, and two of these, named Plasmodium falciparum and Plasmodium vivax, are the most dangerous one. The difference of these two is that the Plasmodium vivax is causing benign malaria with low incidence of complication compared to this Plasmodium falciparum.
Good day everyone, my name is Regina de la Peña and now let's know about the pathophysiology of malaria. The malaria parasite life cycle involves two hosts. During a blood meal, a malaria-infected female Anopheles mosquito inoculates sporocytes into human host. Sporocytes infect liver cells. There the sporocytes mature into sessons. The sessons rupture and release myrocytes. This initial replication in the liver is called exoerythrocytic cycle. Myrocytes infect RBCs. There the parasites multiplies asexually, called the erythrocytic cycle. The myrocytes develop into ring stage trophocytes. Some then mature into sessons. The sessons rupture and releasing myrocytes.
So good day everyone, my name is Elisent Claveria, and for the continuation of pathophysiology, some trophozoites differentiate into gametocytes. During a blood meal, an Anopheles mosquito ingests the male and female gametocytes, beginning the sporogenic cycle. In the mosquito's stomach, the microgametes penetrate the macrogametes, producing zygotes. The zygotes became motile and elongated, developing into oocytes. The oocytes invade the midgut wall of the mosquito where they develop into oocytes. The oocytes grow, rupture, and release sporozoites which travel to the mosquito salivary glands. Inoculation of the sporozoites into new human hosts perpetuates the malaria life cycle.
Good day, my name is Jessica Scon. So let's come now to the diagnostic procedure. So first we have microscopy, which is a skin thick blood films or smears. This is to see what type of malaria parasite you have and how many parasites are in your blood. So to assist in diagnostic procedure, MRT-DTS is used to diagnose malaria by detecting evidence of malaria parasite in the human blood. So as you can see in this uh, illustration, there is a buffer hole and a square hole which is for blood, and this is the result window to see your result if you're positive for malaria. So there are three additional diagnostic procedures that can be used, which is polymerase chain reaction or PCR and CBC and blood glucose test.
So for the treatment for malaria, to treat it is by using prescription drugs to kill the parasites. So the type of drugs and the length of treatment will depend on the type of malaria parasites you have, the age of the patient, if the patient is pregnant, and the severity of the symptoms. And the medication that's mostly used is chloroquine phosphate is preferable treatment for any parasites that is sensitive to the drug, and as well for etrusine-based combination therapy, also known for ACTS, and it says it in the name, where they're going to combine 2 or more drugs that works against the parasites in different ways and help to treat the malaria.
Good day, my name is Kanger Domingo and I'm with my partner Fiona Costa and we're going to discuss the nursing care for malaria. So we're going to start in improving the body temperature of the patient. In order to improve the temperature, we need to provide water compress on the forehead and both axilla for 15 minutes. Second, we need to maintain warm environment by using warm blankets or any comfortable clothing. Also, we need to take note that the patient may sweat excessively, so we need to avoid exposing the patient to wet clothes and linens. Lastly, we need to administer antipyretic as the doctor ordered. Next is to improve the tissue perfusion, and this can be a life-saving, especially for unconscious patients. First, we need to maintain a clear airway, and position the patient in a semi-prone position to avoid aspiration of fluid. Now, if the patient is unconscious, we need to insert a nasogastric tube and aspirate the stomach contents to minimize the risk for aspiration pneumonia.
Good afternoon, everyone. I am Fiona Acosta, and I will be continuing discussing the nursing care. Improve the fluid volume. We must expect the loss of fluid through sweat. We must anticipate fluid loss through sweat associated with fever. And then to monitor the fluid balance through the use of fluid balance chart, and then assess for the dehydration of the client or the patient, and then administer parental fluid as appropriate or ordered. And then educate the patient and the family. We must assess the patient's knowledge of the disease and its process and risk. Discuss the importance of adhering of the treatment plan, and then review and then explain the medication with the patient or the carer or the family or the trusted individual by the patient, and then supply the patient with reading material or documentation if needed.